Okay, you've said goodbye to periods, you've stocked up on wine to celebrate, and you've burnt your old stash of tampons and pads in a bonfire of freedom. Life's good, right? But out of nowhere, you find yourself face to face with a bloody plot twist. Bleeding? Again? Can't I catch a break? Believe me, I feel your pain. This mysterious bleeding made me question everything I thought I knew about menopause. But let's get the first question out of the way. What the heck is postmenopausal bleeding anyway? Well, once menopause sets in, any vaginal bleeding is postmenopausal bleeding. However, it can vary among women. Some might see a small amount of blood, bleeding that mimics a regular period, blood clots, a heavier flow than what they used to experience, blood that appears after vaginal intercourse, blood that appears on toilet paper after using the bathroom, or even pink or brown discharge. Now, I know what you're thinking. Shouldn't menopause mean the end of all bleeding shenanigans? Well, sort of. There are 5 possible reasons Aunt Flo would make a comeback. The first and the likeliest cause is usually vaginal atrophy. You see, after menopause, our hormones, such as estrogen, hit rock bottom. And because estrogen is what keeps our skin soft, supple, and elastic, with a lower estrogen count, our vaginal walls thin out and become dry and inflamed. This is called vaginal atrophy. It often causes discomfort and bleeding, especially after intercourse. Now, if you're taking hormones, some types, like prostrogens, may add to the imbalance. This can cause even more postmenopausal bleeding. But fear not, we'll be going into your treatment options later in this video. For now, let's talk about polyps and fibroids. These are tiny, fleshy growths that decide to set up camp in your uterus. And, like unwanted guests who show up at your party, they refuse to leave. When they push against our uterus walls, it can cause bleeding. For some of us, we're more prone to developing them due to our genes. For example, if your mom, grandma, or aunts have a history of these growths, you're more likely to have them as well. In fact, they are one of the more common causes for some very alarming bleeding episodes. Why does this happen? Well, too much estrogen, even at lower amounts, can cause these growths. That's because when our progesterone levels decline during menopause, it can cause an estrogen dominance. So, don't think just because you're postmenopausal that this can't happen to you. Now, let's talk about number 3, atrophic vaginitis. Like I said just now, without enough estrogen, our vaginal walls turn into a dry desert. This makes our vaginal lining prime targets for irritation and infection, causing it to become inflamed, angry, and prone to bleeding, a condition called atrophic vaginitis. Bleeding from infections or inflammation isn't something to brush off. In fact, you should seek medical attention ASAP before things get worse. Alright ladies, now let's address the elephant in the room, cancer. While most postmenopausal bleeding is benign, we can't ignore that it can be a potential warning sign of something serious like endometrial cancer. Other symptoms include pelvic pain, unexplained weight loss, difficult or painful urination, an enlarged uterus, pain during intercourse, or weakness or pain in the lower abdomen, back, or legs. Now, before you start panicking, let's get one thing straight. According to a 2018 study, postmenopausal women with vaginal bleeding have a low risk of endometrial cancer. In North America, only 5% of women with postmenopausal bleeding are diagnosed with endometrial cancer. That being said, it's crucial to take this symptom seriously and seek medical help. And don't worry, just so you can be prepared, here are some of the medical tests and examinations your doctor may recommend. Number 1, doctor evaluation. When you visit your doctor, expect questions about your menstrual cycle before menopause, as well as previous health issues. medications, and family history of cancer. These details help paint a clearer picture of potential causes for the bleeding. Next, brace yourself for a physical examination. Your doctor may conduct breast and pelvic exams to assess your reproductive organs. A thyroid test may even be recommended to rule out thyroid imbalances. Number 2. The Pap smear. This involves your doctor collecting cervix cells to check for abnormalities. It's important for the early detection and prevention of cervical cancer. And here's what to expect during a Pap smear. You'll have to lie down while a speculum is inserted into your vagina and cervix to collect cell samples. This may cause mild discomfort or pressure, but is generally quick. Afterward, you may experience light spotting or minimal cramping, but that resolves within a day or two. Number 3. Transvaginal ultrasound. Your doctor may want to get clear pictures of your reproductive organs. During this procedure, a small wand-like device is gently inserted into the vagina. Then it emits sound waves that create detailed images on a computer screen. Transvaginal ultrasounds are useful for measuring endometrial thickness. If they find an increased thickness or anything suspicious, they may need more tests. Number 4. Endometrial biopsy. Brace yourself because this involves taking a tiny sample from your uterine lining. Some women say they experience cramping during the procedure and it may last for up to 48 hours. So pop an Advil to help reduce any discomfort. In any case, this biopsy may be a lifesaver. It helps detect any sign of endometrial cancer or cell abnormalities to narrow down the potential causes of postmenopausal bleeding. Number 5. Hysteroscopy. Now, this is regarded as the gold standard diagnostic tool for postmenopausal bleeding. It allows your doctor to carefully examine the inside of your uterus for red flags. Here's what to expect for a hysteroscopy. It involves a thin tube inserted through your cervix to see inside your uterus. There, your doctor can look for any abnormalities and take samples if needed. It's normal to bleed for 7 to 10 days after the procedure, which might be heavier than a normal period and can stop and start. Now, you're probably wondering, what are my treatment options? Don't worry, I've got you. Depending on your diagnosis, your doctor may recommend any of these options, starting with medication. If an infection is causing the bleeding, antibiotics are usually used to treat it. Or if a hormonal change are the root cause, hormone therapy may be offered too. Or, depending on the doctor's findings, you may need surgical intervention. This is usually to address bleeding caused by polyps or fibroids. Depending on the size and location of these growths, they can be removed in a day clinic under local anesthesia. Or you may be required to undergo a general anesthesia in a hospital. Another surgical option is a hysterectomy. This involves the removal of all or part of the uterus and cervix. There are different ways to perform a hysterectomy, and some are minimally invasive, only involving small incisions. In some instances, the surgeon may also remove the ovaries, fallopian tubes, or nearby lymph nodes. While the thought of surgery may feel daunting, if it's deemed necessary, remember it's what's needed to restore your well-being. Click here for some natural foods you can take to help manage postmenopausal bleeding.